God of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll have roll call next.
Here. Mary Megan.
Here.
Jason McBride. Deanna Garber. Here. Tom Henning.
Here. We have adopted an agenda. Do I hear a motion?
Yes, one thing that I would maybe consider adding to the agenda is if we need it, an executive session with legal counsels, if needed, but if not, then we'll just move right out myself. Just for legal direction. And with that, I would make a motion to adopt the agenda as presented with that addition.
Okay. If you move and seconded to accept the agenda as presented with possibility of executive session. All in favor, say aye. Aye. All opposed? Okay, now we have a recognition of patrons, but I think Mr. Hatfield wants to share a little bit about the meeting the other night.
Yes, I wanted to, first of all, welcome everybody to Wellington High School, and really appreciate you giving up your evening and coming out and to our board meeting. Obviously, we have a topic that has been talked about throughout the community this week, and our board has been active with different members of the community and discussing different ways we can tackle school since it has started. And so we wanted to welcome you and tell you how much we appreciate you being here. How the evening is set up is because we had a turnaround for a board meeting so quickly, we have had for our recognition of patrons and staff. Typically, with board policy, usually you sign up to speak at a board meeting with the board, and that's due 5 days prior to a board meeting. However, since we had a board meeting turnaround so quick, there was not really a sign-up period for people to able to do that according to board policy. And so what we're going to do this evening in this time period is we are going to allow anyone who is interested to share anything they would like to about the topic that we're discussing tonight. And we have a microphone down here. Typically, because this is a board meeting and this is not a town hall or anything like that, we are just having a board meeting in a bigger space where we can open it to the public and give everybody the opportunity to social distance. And so we have a microphone up here. Typically, during a board meeting, a patron or staff is allowed 3 minutes to speak to the board. And so if you would honor the nature of the board meeting and try to keep that within 3 minutes, then that would be very much appreciated. If it gets beyond that, then obviously, as our board president, Mrs. Zika can, ask you to conclude or whatever, try to be polite about it. So anyway, just wanted to welcome you. And at this time, we'll open the floor to anybody who wanted to give a quick, share anything with the board that is on their mind regarding this topic.
Will you have a chance to speak later?
That is not how usually a board meeting is set up. We typically don't have patrons or staff speak at the end of a board meeting. It's more towards the beginning to share their feelings on things.
If this is the only time I have, I'm going to use it. So I'd like for all you sitting up there to think about when you're my age and you got 4 little kids at home. And you send them off to school wearing masks, and they're going for half a day. And then they come home, and now I'm the teacher. Or if I'm not there and my wife's not there, who's the teacher? Nobody. Who can you trust? No little kid is going to sit there in the damn home and do their schoolwork or do what they're supposed to be told to do. These kids need to be back in school full time. Okay? You can bring up every nurse and every health person you know. There's a 99% survival rating of this disease, of this pandemic, of this whatever it is you want to say it is. But put yourself in my shoes. You're up there sitting there making decisions for people that they work an 8-hour, 10-hour, 12-hour day, and they have to come home. Now they got to play teacher also for 4 or 5 hours and making sure the kids get all their stuff done. Well, you sit there and go, well, it's for the kids' safety. There's no kids dying. It's ridiculous. It's what this is. So I hope you take into consideration the statistics. You can say, yeah, this is spreading like wildfire, whatever. It's a bunch of crap. Just please think about the kids. Think about their lives, because this is not normal for kids to go to school wearing masks and putting up dividers and sitting in their chair for 4 hours a day, going home and getting online, looking at a freaking video. It's not normal. This is not what we're supposed to be doing as Americans, as people, as who we are. So, if I could speak later after you guys make your vote or talk about it, I would, but please take into consideration that your decision is influencing a lot of lives, okay? Not just yours, not yours thinking, going, oh, I'm trying to save kids' lives. It's a bunch of crap. There's no kids dying. Like I said, 99% survival rate. I'm really strong and frustrated right now, so.
Okay,
Yeah, thank you.
thanks for coming upstairs. It only takes one person to kind of break the ice. So,
Thank you.
thank you.
Tonight, I was asked to represent Hunter Lowe, who couldn't be here, and he would like me to read the letter that he wrote to the board. There have been recent talks about a sort of full reopening of school, and I would like to address that. I have been waiting for over 200 days for some sort of normalcy, some sort of good news about this inevitable virus. Reopening with a hybrid plan was a step in the right direction, but we're far from finished. Completely opening school again is like falling down the stairs. You're closing your eyes to the harm you may cause, which is preventable. Even if the health issue does not cross your mind, when the first test comes out, our basketball season is gone. Our scholars bowl, our wrestling, our choir, our football, our band, all gone. The small administration of tests currently is only happening because of the guidelines being followed. When school starts completely, the sense of security vanishes. I have followed every guideline, every mask rule, every social distancing rule, every CDC recommendation in these last couple hundred of days, hoping to have my extracurricular activities back. I feel this will completely disregarded and ripped apart for some sort of forced political statement. People's lives are at an actual stake, and the students' mental health will be severely punished if you force this upon us and we shut down. We cannot do this again. Us students can not be put through another shutdown. Hybrid is working. A majority understand that this schedule is what is needed, what needs to happen for a while until it's safer. This routine is what we have grown to and what we need to stick to. I would love to go back to school full time. I would also love to not wear a mask. The only way we are going to get there is doing what we're doing. Please, we have made little advancements since the last shutdown, but our masks and distancing are working. As a basketball player, a cross-country runner, a choir member, a track runner, and the sophomore class president, I felt the need to address this as a statement to everyone I am representing. Thank you for your consideration.
Thank you.
Thank you.
Good evening. I am new to the community. I've lived here just over a year. So it was very frustrating when this first started. My husband and I both work out of town. We had nobody to reach out to. I wanted to start by saying the school district has been amazing to my husband and I to try to go out of their way to accommodate us. I am the chief nursing officer at Sumner County Hospital in Caldwell. I would like to speak more on the medical half of things besides getting completely personal, because we know it's frustrating as parents. The American Academy of Pediatrics, which consists of 67,000 pediatricians across the United States, have all came to the conclusion that these kids need to be back in school. They have voiced their concerns with the emotional outcomes, educational outcomes, behavioral outcomes, and the possible abuse that's all associated with children being at home more. Both the CDC and the American Academy of Pediatrics have also said that kids are not these germ spreaders that we think they are, due to the fact we know older adults seem to have the more severe symptoms. Kids are not showing the symptoms of coughing, sneezing, which makes it less likely for them to spread. The CDC also, along with the American Academy of Pediatrics, has said instead of 6 feet social distancing, it's actually appropriate for them to be 3 feet apart. Child care facilities across the country have remained open through this entire thing with very little outbreaks associated with them. I know that we cannot completely eliminate the risk anywhere or in schools, but we can eliminate it anywhere. I just got an email today saying that via Christie, all 3 of their hospitals in Wichita have also began a new policy that they are going to allow 1 visitor to the patient. Doesn't sound like much, but they are moving to open more things. I support whatever decision you make, but I would strongly like to see the schools open full time. Thank you.
Thank you.
Thank you.
Good evening, my name is Fatima Yunker. I have 2 students attending Wellington High School. I'm probably going to go over the 3 minutes, just to let you all know, but it's not much. I want to begin by sharing a short comparison. In this comparison, I have looked at the environment of our schools, USD353, the teachers and children versus a cashier and a business customer in a store. In this, I won't cover each of the things I have on this list because of the time, but I will touch on my top 5 things. So number 1, a cashier at a store touches the food and other packages that the customers and employees have touched. A teacher at USD 353 is not allowed to distribute or receive assignments in paper form. Number 2, a store cashier interacts with approximately 100 different people on a daily basis, if not more. A teacher interacts with the same number of students on a daily basis, which is roughly 40, if not less, with USD 353. Number 3, a store cashier can spread the virus at a higher rate based on the number of person-to-person contact. A teacher has a more restricted group of people, which results in a lower percentage possibility of virus transmission. Number 4, and the last 2 are very, very important. Number 4, a store cashier has no measurable impact on the mental and physical health of a child. A teacher and administrator at USD 353 has a huge impact on the mental and physical health of a child. And number 5, people entering businesses are not vetted. Some businesses do not even vet their employees. USD 353 has implemented vetting of teachers, admins, students, and visitors that enter the buildings of the school district. That's very important. These 2 lists do not reflect everything that we can compare, but what this does is reveal a strong argument that our kids can attend school and be safe. In this comparison, it could be said that going to the grocery store poses a higher risk of catching or transmitting a virus than going to school does. In addition to that, I would also like to share with you a survey completed by OECD, the Organization of Economic Cooperation and Development. This was completed this year. It is with regard to youth and COVID-19, response, recovery, and resilience. The majority of this information that I will particularly read comes from that survey. The COVID-19 global health emergency and its economic and social impacts have disrupted nearly all aspects of life for all groups in society. People of different ages, however, are experiencing its effects in different ways. For young people, and especially for vulnerable students, the COVID-19 crisis poses considerable risks in the field of education. Moreover, while youth and future generations will shoulder much of the long-term economic and social consequences of this crisis, their well-being may be superseded by short-term economic and equity considerations. Your decision today is an equity consideration. To avoid exasperating intergenerational inequalities and to involve young people in building social resilience, USD353, the Board of Education, needs to anticipate the impact of mitigation and recovery measures across different age groups by applying effective administration actions. Tonight, we are discussing one of the biggest administrative actions of our district. The findings of the OECD survey confirm significant psychological impacts of social distancing and quarantine measures on young people, causing stress, anxiety, and loneliness. This is also affirmed by the findings in 2 other studies for the OECD. Evidence from previous pandemics suggests that exposure to domestic violence increases during lockdown measures, leaving adolescents, children, and women vulnerable to violence by family members and intimate partners with long-term psychological impact. And that's something we need to consider, the psychological impact. Since the outbreak of COVID-19, online inquiries to violence prevention hotlines have risen up to 5 times, while emergency calls reporting domestic violence against women and children have increased by 60% compared to the same period of the previous year. A decision to maintain closure of USD353 affects students' mental well-being, as teachers and classmates can provide social and emotional support. Education professionals also play an important role in helping detect and report abuse against children. School is very valuable to a lot of kids in our district. When you look at the socioeconomics and the levels between financial status. The impact of the crisis on the psychosocial and subjective well-being of young people also depends on the household they live in and the individual circumstances. Having shared this with you, I ask that the conversation to reopen school consider all children and the different types of households. If possible, please consider maintaining remote learning for those families that do not want their children to return to school, but open back up a traditional schooling, full days, Monday through Friday, for the families like mine that feel it is imperative for our kids to physically attend classes. Thank you.
Thank you.
Thank you.
Good evening. My name is Jessica Seelder. I'm the mom of 2 Eisenhower Eagles. Holden is in 2nd grade. Harper is in 5th. I'm a former newspaper publisher, turned stay-at-home mom, turned part-time baker. I have absolutely no background in education, and I have even less knowledge in the medical field. It would be absurd for me to stand in front of you and tell you what education in our district during a pandemic should look like. Now, should you need a press release or a wedding cake, I'm your gal. But for me to tell you what students need right now is ludicrous. I'll leave that to the professionals. And that is what I'm here tonight to ask of you as well. In August, we were asked to choose one of 2 plans for our children for the first 9 weeks of learning. Personally, I was on the fence. I spoke with family friends and family members who are teachers, and I spoke with our family care physician twice. I used the advice that I got from those pros to make the best decision for our family. We felt safe putting our trust into the guidance of the Sumner County Health Department and choose the phased learning plan. As far as education that my children were receiving, I felt confident in any platform that Dr. Kern and Mr. Hatfield and the teaching staff at USD 353 came up with. I know that working part-time from home, I do not personally know the challenges that many others are facing with each unique schedule. I understand, I probably never will understand, but I empathize with those who are finding it hard to juggle work and school and everything in between. While I have my own struggles, I would be lying if I told you that I completely know what they're going through. But that being said, our kids were in school for a total of 4 days before the call to make a change. 4 days. We're standing here now 8 days in, ready to ignore the advice of medical professionals and toss aside the hard work of our very own educators and district staff out of a convenience for ourselves. Last I checked, pandemic isn't convenient and parenting isn't easy. If we want to stop now, after just 8 days, what are we teaching our kids? When it's hard, just give up. If it's a change, you don't have to do it because it's uncomfortable, just throw it aside. Those are not things I ever thought that my students would be learning in this district. This pandemic is bigger than the school. It's bigger than the classroom. It's about our community. Kids may not be super spreaders. One brings it home, gives it to grandma. Grandma goes to Walmart, gives it to someone. Grandma goes to Bridge Club, gives it to someone. We've got a much bigger issue than just that classroom. It's not about us. It's about our community as a whole. If the Sumner County Health Department or our own local physicians declare it safe to go back full time, my kids would be there with a smile on their faces. But until then, we need to pay heed the advice of those that know much more about virus and community health than any of the rest of us. My biggest fear is moving too fast for the wrong reasons and going virtual sooner than later. That would crush my kids and be an even bigger inconvenience for all of us. In August, you asked me to sign a 9-week commitment. Tonight, I'm asking you to stick to your end of that deal. Thank you.
Thank you. Anybody else?
Sorry, me and my asthma can't talk and do this in a mask. So, as most of you know, I'm the director at On's Place, and we are currently doing the struggle of homeschooling 15 to 20 kids. We got the rude awakening, and it's been the best partnership with the school district that I've ever experienced. So, props to everyone. And being raised with mom as a teacher, I always naturally side with education. So, this had me torn because is my job going to be easier if you guys go full in person? Heck yeah. It's going to be super easy because all 15 of my kids are going to be at your guys' schools. Is that what's best for the kids? No. Like Jessica said, which was amazing, so props to you. I have kids right now that are doing athletics for the first time ever in the high school setting, and they're in foster care. It is a game changer for them. They are passionate about things they've never been passionate about. We have someone doing volleyball. We have cheer. We have 2 kids going out for band. I know my heart was broken back in March when my Shockers did not get to have March Madness. We called it March Sadness, and we were ticked. When I didn't get to go eat at a restaurant for however many days, I was ticked. It was all because of the shutdown, and my whole worry, just like Jessica said, was if we don't stick to the 9-week commitment, all I'm saying is not yet. I'm not saying don't do it because I want the kids to have the full experience of school because we have brand new kids in foster care showing up tonight that'll hopefully be in school by Monday or Tuesday. We'll get with you, Daniel. But we want them to have the full experience. I have to, every once in a while, drop my mask down to let them know I am smiling when we're talking. It's a time I never thought we'd be in, and if Mrs. Hadwin would have been my 5th grade teacher with a mask, I would have been even more freaked out than I was with her as a regular 5th grade teacher. So, sorry. But this isn't normal for anybody. This isn't parenting for anybody. I became a parent for the first time this year, and homeschooling a kid is not easy. My mom and my sister can teach. I cannot. That's why I don't. But if you guys truly value our kids' safety, our teachers' safety, our admin safety, listen to the health department and at least stick with the not yet. We're not saying not ever because I want the kids back in school, but not yet, because if all the Zikas and everyone else lose out on sports for their kids, it's going to be heartbreaking. You guys have half the roster, so just please give it a chance and let it work. 4 days isn't enough, 8 days isn't enough, so stick with 9 weeks, and at 9 weeks, I will load all those kids up and send it back to you. Thanks.
Thank you.
Thank you. Anyone else this evening that would like to say anything to the board before we wrap up this portion of the evening? Okay. Oh, I'm sorry.
Sorry,
I'm
I
sorry.
wasn't going to, but.
No, you're fine. Go ahead.
My name's Megan Allender. I am relatively new to the town too. I moved here in December. My daughter is a kindergartner. She goes to Kennedy. I've sent emails. I did the survey as well. I didn't think I'd have to talk, but apparently I do. I'm pro full-time school. I know we did sign the 9 week to have your, the commitment. However, you guys did say you would address it after 2 weeks. The 2 week is, at the end of this week. There have been no, active cases from school, football games, what have you. There are currently 5 active cases in all of Sumner County, which to me does not warrant hybrid in Sumner County. I think that's kind of ridiculous. I just want to know when the number has to be low enough to be full-time. My daughter is 5 years old. Social interaction is crucial at her age. She does not benefit from going to school 3 hours a day, and then mom works the entire day and gives her less than in the evening to try and teach her. My background is actually elementary education, so I'm more than capable of teaching her, but when I work 8 hours a day and I come home and I'm exhausted, I can't give her what she needs. And she looks at me as mom. She doesn't look at me as a teacher. Okay, so that's hard. Sorry, I'm just getting kind of worked up. But I just think it is absolutely crucial to get those kids back in full-time school. The remote option is there for the parents that do not agree with that. And if they want to keep their kids at home, they can certainly do that if there's a change of heart. But that's what I think. Sorry, I was kind of put on the spot, but I just wanted to get my opinion out there.
Thank you. Anybody else want to?
I think most of you know me. I'm Jennifer Worthy, and I teach 7th grade at Lincoln. I have 3 students, high school, middle schooler, and a 4th grader. So I'm here as a teacher saying, we've worked really hard. We want your kids. We want your kids. Dead serious. I want them all in my room, but I want them safe. And right now in my classroom, if you turn out on Monday, I'm afraid I'm not going to be able to keep them safe, or myself safe, or my family. As a parent, I get it. I got 3 kids, keep track of schedules, transporting them between working all day as well. I teach my kids at home at night to make sure that they get all their homework done. My 4th grader, he is not going to be an independent learner yet. And so we do his homework at night, when I get home from work and when he gets home from school. So I get it's not convenient, but I think if our health department is saying, let's stay hybrid, I feel like we need to listen. I do think we need our all in person. I love having my kids right now in small groups. Literally the math lesson that normally takes me an hour and a half to get through, I was done in 45 minutes today, and it was like, whoa, it never happened. So I do think the kids are learning. I think they're learning quicker because there is a smaller group of kids in my classroom right now. Behaviors are not happening. Masks, so far, have not been an issue, but we do take a break halfway through the morning with my second graders because they can't make it all day without taking them off or fidgeting with them. So we take a break. But I don't know if all day is the right decision yet. Would I like to see us there? Of course. And I will say, as a parent, if we do go all in person, there will be parents that will go all remote, including most likely all three of my children. So right now they are in hybrid, so they are in school half day. But if we go all in person, I'm afraid there's just going to be too many kids, and we can try everything we can to keep them safe. But I can tell you, in my classroom, I understand 3 feet would probably be safe. But I can't guarantee 3 feet in my classroom. So I don't know about all the other classrooms in the district. And I know my middle schooler says she has 30-some kids in a class already in an elective class. So what is that gonna look like when they're all in person and there's not enough seats and be able to distance? So that's all I want to take. Thank you.
Thank you.
Good evening, I'm Shauna Yarmer. I'm one of the family physicians here at the clinic at Sumner County Family Care Center. Kind of as Jessica so eloquently put, my background is not in education, so to say that I can understand that part of it is obviously very far from the truth, but I can speak from the medical side of things. Unfortunately, coronavirus is a little bit different in our other communicable diseases because of such a long latency period. We will not see the effects of the first day of school, of even Labor Day, until 2 weeks, up to 14 days is the latency period you can see on a positive test. I'm going to take this off since no one's within 6 feet. So it's a little bit premature, I think, to say that we're doing well, because we don't know if we're doing well. We won't know if we're doing well until next week. And so I think we need to at least wait for that 14-day time period to elapse so that we can look at numbers. It is looking very good, though. I will tell you, we are at what we call a level pace versus an uptick. I think if you look at the gating criteria on the KDHE website, we are in what we call the yellow zone. Are you guys using the KDHE criteria to base the decisions?
Yes.
Okay. I know one of the recommendations in the yellow model is a hybrid model and possible on-site for K through 5. There were several caveats to that. It sounds like they want groups in 15 or smaller and to be able to maintain that 6 feet social distance, which I don't know what all of the different elementary school classrooms look like, so I can't speak on that. But I am also a parent. I have an 8th grader at the middle school, and I have 2 students who are learning at WCA. They fortunately have such small numbers there that they are able to be full person in class because they only have 12 to a classroom, and they can isolate from all of the other rooms. Each room has its own outer entrance, et cetera, et cetera. So I do empathize with parents in that the schedule is very difficult. I am about to pull my hair out at the clinic some days when I'm trying to see patients and trying to make sure my 8th grader can get where she needs to be, but she could honestly fend for herself. So realistically, I don't have to be fearful of that. So I do feel for the parents with the elementary school ages, and I think that there needs to be something. I don't know what that answer is, but if you know, if we're not able to go to an on-site learning soon for that K through 5 age, you guys are gonna have to come up with something for these parents, where they can, you know, maybe stay in the gym and space. I know that's what several of the recommendations I had looked at on websites where, you know, when the older levels maybe aren't there, that those kids are in a middle school gym or in a high school gym and they're spaced out working with a para, you know, on their work if parents aren't available to be able to maintain that program at home. I've looked, and it sounds like maybe Newton is moving to on-site learning on September 23rd. I saw Lake, I didn't really look at the models they were using, is moving to in-person learning. But again, I would urge you to use caution in that we don't know yet what our numbers look like from the first day. And so we're gonna have to go very slow with that. Ultimately, I don't have a very strong recommendation other than I think we need to follow the guidelines. But I do want my kids to continue to be able to go to school, whether that's hybrid, full person, whatever. And I want my kids to be able to continue to do extracurricular activities. So if you guys have any direct questions about anything or the virus or the criteria or anything, I'm happy to answer those.
You said on the WCA, they're going full.
Yes, they only have 12.
So did they get with the health department on that, or do you?
I don't know. I know Mr. Showman was in contact with the local physicians, and he was very up on reading on the pediatric guidelines. They made a decision at the last minute for their preschool to wear masks because of the literature. So he kind of studied the literature himself and met with the board there at WCA. And again, they're able, all of the caveats on the gating criteria that, you know, Paddock said you guys are looking at, there's a second page to that for the K through 5 on-site, and it's that you have pods less than 15 and that they can maintain the 6 feet of social distance and wear masks. And it still applies the same to like no all school activities. I mean, it's not like you just, it's a free for all.
Do all grades wear masks?
I'm sorry?
Do all grades wear masks?
Yes, oh, for sure. They even, like I said, went to the preschool, 3-year-olds, 3 through 5-year-olds wear masks. They don't have to wear them at recess. They get a mask break, is my understanding, at their desk as well. But my son, you know how kids are, you try to ask him questions and it's like, I don't even know what he's trying to tell me.
Well, thank you for sharing and offering your.
Thank you very much.
Good evening. I wasn't expecting to speak, but after hearing a couple of different opinions, and I respect everyone's opinions, I wanted to give you mine. I am the director of a vocational school in Wichita, Kansas, but currently live in Wellington. My daughter goes to school here at the high school, and I just wanted to share, I know that it's a little bit differently because we are dealing with young adults where I'm at, and that it is a little bit different than dealing with elementary school children. However, I just wanted to share with you that we did, because we are accredited and receive financial aid, we do have to go through different governing bodies, 4 different governing bodies to be able to have a hybrid school. We did do hybrid when we shut down, and we felt like it was the best opportunity for our students to get back into that school because that was the best way for them to learn. We were apprehensive by doing that because we couldn't social distance in the classrooms, so we made masks mandatory. Mask has been mandatory since we've been back in May, and we require that all of our students and our instructors wash their hands frequently, and we sanitize frequently throughout the day as well. We stop and do that. What I want to share is that because we make masks mandatory, we cannot social distance in our classrooms. We did social distance on our clinic floor. However, we stopped that and went back to that just recently. But because our classes are anywhere from 14 to 25 students in a classroom, we don't have the space to do that. But because we require masks and will continue to require masks, we have taken out chairs from their student break room for them to be able to eat lunches, just because we don't want them to congregate back there. We require that they either eat in their car or we eat outside on their patio. My point in saying this is because we require masks and we are very adamant on how we wear them and making sure that they wear them even though they don't want to correctly. Since May in our establishment where I have 32 staff and 130 to 150 students, we have had only 5 cases since May. I contribute that to us wearing masks on a daily basis and making sure that we are constantly sanitizing and constantly washing our hands. And I think that even though this is a little bit different than what you are all having to make a decision on, I think it is relevant to at least let you know that on my end, even though it is a little bit of a different education, that is what has helped us. So I am for you guys voting to send kids back to school full-time. I have a daughter who has an IEP, who has a learning disability, and she can't learn with 3 hours, and she cannot effectively learn what she needs to learn without being in school the full time. Thank you for your time.
Thank you very much. Have anyone else that would like to share with the board? Okay. We're good to move on.
I just want to thank everybody that did share. I know it's not easy. Get up front and talk to people if you're not used to that. And you did your research and it was good to hear from both sides. So we do appreciate you guys just coming tonight to begin with, and then if you took the opportunity to speak, that's we appreciate that too. So we'll start by just sharing our thoughts and asking questions.
Adam, I first would like to have you clarify that nowhere did we say we were going to have 9 weeks of hybrid, that we were going to follow the guidelines of the health department, and at any given week, if they gave us the green light, we were going full time.
Right.
Okay.
And just to clarify, thank you for bringing that up. The reopening plan that the board originally voted on and approved, we are actually week to week in either, obviously we have students that have decided to go entirely remote this year. We also have students that are decided to go in person. And the in-person education is strictly built on trying to follow health guidelines and keep everybody safe. So the way it was built was we contact the health department. We have a meeting once a week to find out where numbers are at. And then I have a weekly share out to the community as to where that goes, as to where we are going to go from there. And that allows everyone to, get a little bit of time to plan. Our plan was very much, we all knew that this is not based on convenience. It is based on keeping people safe. And that was the plan from the get-go for our in-person plan. So what we put in there as far as 9 weeks is at the 9 weeks, we wanted to, after people have experienced education as they had chosen for those 9 weeks, we wanted to give everybody an opportunity to then switch if they chose to. And that meant that if you were in person and a parent was feeling like they were, the things at school were not safe for their child, they could switch to remote. And if they were in remote and they felt like that was not going very well at home, then they could switch to in person. And so that was supposed to go continuously to the 9 weeks. It wasn't about switching to the different models. It was about having the 9 weeks switch over for parents. And we still plan on doing that. That obviously is a concern with this particular issue with parents who are counting on us to follow guidelines with the health department. When they signed up for our plan, they had us following guidelines for the health department. If we change that, then they are, may feel fearful about what they decided to do with that first decision. So that's kind of where the debate has gone this week. And so the 9 weeks was really, the 9 week talk is really about switching from in-person to remote, not necessarily any switching of hybrid to remote to all full in-person. There is not one person in this room, on the stage, in the audience, that wants anything except to go in person. It is much, the plan that we have together is built off of health guidelines based off of us not being medical professionals and following medical professional advice. And that's where that all originated. We worked on that with guidance from KSDE all summer, and many districts are choosing between those three based off of their board discussions and working with their local medical professionals. And each community is different at this time. Did I explain well enough?
I think we do need to clear up from Monday meeting. Mr. Hatfield was asked a question about how soon, if we chose to go full on, full face-to-face, how long it would take teachers to be prepared.
Yes.
And his answer was he wasn't quite sure yet. And I think some of us, it was taken as teachers wouldn't be ready. Well, in clearing that up, it meant that if we do decide to go full on, we don't know the number of people that would choose, instead of going full face-to-face, would choose to go completely remote. And the difference in that would be if a large amount of people went completely remote, we would have to do more numbers and find staff and that sort of thing. So it was just a little misunderstanding between the question and the answer.
Yes, and I apologize for any miscommunication. If I miscommunicated that night, that is on me 100%. We are fully ready to go back to school full time. We have been doing that since the late 1800s as public schools. We are ready to go full time anytime that is available for us to do so. What it comes down to is the decision to follow, for that decision to be made off of our local health department and medical advice. And the issue that I was talking about the other night was if we make that decision without the blessing of those medical personnel, then we will have parents that signed up for in-person based off of us following that medical advice. And so if we move away from that, we may have a lot of people that were in person that may choose to go remote because now they know the district is not following that medical advice. And therefore, and we did some surveys this week and found out some information on that. So, sorry, Pat, I hope that clarified a little better. So,
No,
thank you.
I'm just going to open up the board for questions and what you guys want.
Can we ask Laura questions?
Sure, yeah. We have a couple members from the health department here that are more than willing to, and I just want to say that Laura's been a great partner in this. And, she has obviously had her hands full all year this year with lots of different things, and I appreciate her help.
Hi, Laura, I had a question. We have a lot of parents that have emailed, and a lot of the concerns is childcare, things that they can't handle, trying to handle everything with life, plus got kids at home. So can you clarify if a student is exposed, will that student be required to stay home for 14 days?
If that depends.
Okay.
Each case is different, so I'm going to try to do a generic scenario. Schools have been offered a modified quarantine. If they're a contact, they're not a positive person, they're a contact. It just depends on the class. If it's like a student that was positive, they're in the classroom, and then they're probably going to be allowed to be in school and under modified quarantine.
In other words, you're saying that because they're in that group together.
That cohort.
They're in the cohort, and so therefore they can go ahead and go to school.
Right, and there's, going to be restrictions. They'll go in one door, out one door. They won't, intermingle with other groups. So there are some limitations there. That's what KDHE and the school board worked, state school board worked on that modified quarantine.
also be if we were to go to full-time?
It's going to be much more difficult at full-time. If you can maintain those classrooms where those cohorts don't mingle with, the other students, it's possibly
So
going to
in elementary, we can do it, but secondary would be
hard. The modified quarantine does not, even though it says in the guidance K through 12, it's really only K through 5 because they don't move from classroom to classroom.
So what is your criteria for saying we can open up with your blessing? What's the criteria?
The criteria, it's a recommendation on our part, like for this recent one. We were only in school 4 days, but we're coming out of a holiday, and the 14 days is the incubation period. And I recommended that you do not change until we see what happens when school comes back in, after, 14 days, whether there's going to be a change in the increase in cases. We have, like the 4th of July we spiked, because of change of behaviors. More people were mingling, no mask wearing. So I was unsure about what was going to happen. Plus, school-age children have not been back into school, so they've really been protected. And it's too soon to know how getting back together is going to affect them, whether they're going to become infected more. I can tell you today, late this afternoon, we received 2 positive reports of school-age children. Sorry, I'm going to lose my voice here talking.
In Wellington?
I'm not going to say yet everything because I don't know all the details. I do believe one is a resident in Wellington. That's as far as I'm going to go with details. I do not have that information. And that's more than I usually say about demographics.
So I said, that's still not exactly an answer to the question I thought I asked. What does it take? Just say we've been in school and we passed all the things you just said. At what point is it okay to go, everybody go to school? I mean, do you have a number of percentage of positives? Do you have a number of active cases? where are you drawing the line?
Well, if you're using the gating criteria, which is what we have talked about, you're going to have a 2-week percent positivity rate, and that needs to be below 5%, according to your gating criteria that was put out. Right now, we're at about 8.4%, I believe, for the 2-week positivity rate across the county.
But aren't we supposed to be using just Wellington?
Yeah, whenever we have a discussion, it's about Wellington.
So what is Wellington's positivity rate?
That I have not taken, and I've been too busy dealing with. One of the other aspects I have to work with is with nursing home testing. So, not necessarily school-age kids. I can't give you the exact numbers, but there have been an increase in positive cases for some Wellington residents over the past week. I'll have to go back to my office to get more data on how many cases. So,
I think that's one of the big concerns with a lot of people is we don't know where the cases are. And I know you can't say who, but I believe Kelly County at least gives the zip code, so they would know how many are in a certain area from their county. And when you hear there's 5 active cases, you think, well, I'm in Wellington, and Center County is all of this area.
we have more than 5 active cases. Wednesday it was 20 active cases. That I started out doing, zip codes. I do not always have the staff and the time to record that and then to publish it out. I would caution you that it is everywhere in this county. And larger population areas such as Wellington will always have a higher number, and just in general. As in the northern half of this county has a higher population, so it too will probably have a higher number of cases.
What, do you have to have symptoms to be tested in Wellington?
For the testing that we're doing at our health department, yes, it is a requirement of the state. There's state supplied tests, so we don't have to charge anyone. You just have to call and you'll be screened. And I believe the same thing is at the physician's office. Dr. Garner could probably answer that.
Yes, we totally, currently, we hope to get more testing supplies to be able to make more progress.
And I have the same issue. I'm looking into.
So right now, Tony, you're saying you have to have symptoms at the office?
Right.
Yeah.
And, you know, we will also assess to see if, you know, if you've been around someone, if there's a possibility. We're going to try and test as many people as we can.
What's the turnaround rate?
The state turns around, most of them come in 48 hours, but if they get busy at the state, it could be longer than that. I mean, they have a testing capacity of several thousand a day, but they do get behind every once in a while, so it could be, for our tests, our PCR, the tests that are done at the private labs or the reference labs could be a lot longer.
So what turnaround rate do you see, Dr. Garner?
When we test through the health department, I typically see 4 to 5 days average. My lab core testing was right at about 48 hours, which is amazing. Unfortunately, lab core didn't appreciate us dropping the contract with them since we'll be joining via Christie. And so they, I think they want to cut off our supply in the first slot. So now we're kind of in this holding pattern until October 1st, once the Christie's allow comes in and brings us resources like that.
Thank you.
I'm sorry, can I ask a question?
Yes.
For you? Could you define active cases for me? Are you talking, when you say active cases, are you referring to people that have tested positive for COVID? Or are you referring to cases that there's a test pending? Because I've heard, and I don't know if it's true or not, that a case that is pending is considered active and positive until it comes back negative. So can you define for me what an active case is?
An active case to us is someone who's still showing symptoms and has not recovered sufficiently from the disease.
But not necessarily tested positive.
No, they have tested positive.
They have tested positive. Okay.
Yes.
Thank you.
You're welcome. Any other questions?
Yeah, I have a question. So the surrounding communities such as Belle Plaine, Oxford, South Haven, Caldwell, are they still, do they have a different percentage rate of positive tests, or is it test in that city? How does it work for the other schools that have opened? Or have they went against the recommendations?
Each school district has done a little bit different. They will call, they are using probably the same gating criteria, but they may not necessarily be focusing in on a rate for their zip code.
Can I ask a question? You said you don't necessarily have our specific zip code gating criteria back, our percentage for Wellington. When was the last positive percentage that you yielded for our community?
Can I ask you to clarify what you're meaning by?
Well, you
gating
said
criteria
the
and
gating
positive
criteria that you had was 8% last you checked.
That was this afternoon.
Okay, because earlier you said.
That's for all of Sumner County.
Right.
It's all for all of
And-
Sumner
and
County.
we're
We're just
he
going
asked-
off of, well, it
Right.
depends what the school board wants to.
Right, and that's. and
That's
he
gonna
was-
take me a little bit more time to gather. I didn't come with that information.
So
Okay,
you
I
don't
guess
have a
that's
previous
the
number,
concern.
you don't, I know you don't have the current number, but you don't have a previous number from like a week ago or a month ago or anything like
Previous
that?
number for
Wellington.
Wellington,
Yeah, for one.
not at the present time.
Okay.
But that's the concern, I guess.
Okay, does the board have any more, I mean, I think most of mine has been answered. You guys have any? partly in my mind, it's frustrating that the city council and county commissioners chose to go against, we're asking kids not to go to school because of all these things that you mentioned, and they're everywhere, it's true. But our own county commissioners and city council say different things, and so we're the group that's supposed to follow the health department when other entities aren't. And that's, to a lot of people, that's really frustrating and doesn't help with their decision making because mixed messages are out there.
So I've had some questions. If the board did make the decision to go back face to face, I assume we're not looking at doing away with masks. The mask would be still part of, because I've had a lot of questions from parents. Some of them actually more upset about having to wear a mask every day versus a hybrid schedule. So I just wanted to make sure that was out there for everybody to know.
We all think masks.
We're not looking at doing away with the mask. So, and then the question I have is if, we did decide to go against local health department guide or recommendations. What recommendations do we look to? Who is our next guiding entity? I mean, are we going to call Adam every morning and say, are we going to school tomorrow? I guess I don't know who we look to if we don't look to them. That's just more of a question than anything, because I don't know. I just would like a little clarification on that. Other than that, yeah, thank you, Laura, for some information. I would like more local information. If you can get that for us, that'd be very helpful.
Okay.
That's all I had, really. Just some kind of questions that I had. I contacted several parents that sent us emails. We all got emails. Some of them I grew up with or were friends with, so I contacted them directly and talked to them just a little bit more in depth because you can't ever get the full gist of an email sometimes. So it's a little bit better to talk on the phone and kind of get it face to face, for lack of a better term. And yeah, those were just a couple of the concerns that I heard from parents. So I just wanted to get that kind of on the record. Thanks.
I've heard more than once. It sounds like, if we give it a little more time, we'll get further away from Labor Day and further away from the start of school, and that might be a good thing, to see what the numbers do as time goes by. I don't know how much time we need. It sounds like it's too quick doing it like right now, but if we get further away from Labor Day, we may be in better shape.
I think we're all looking for an expiration date on this, and we still really don't have one other than 2 weeks after the start of school, 2 weeks after a holiday, and less than 5%. The survey results came back, alarmingly 68% of the parents were in favor of going against the health department recommendation. Actually 65%, my math was off. The surprising thing was the staff, it balanced out. If you added the parents and the staff together, it's almost 50%, right on money. I do agree, I think it was Dr. Yarner that said, we can't let this keep going on. I'm ready to open the school, but I'm also respecting the results of the survey, the emails I got. But we have to do something for the K-5 kids if this keeps dragging on. I don't know if we're quite prepared to vote on this tonight, but we do have to. We have to keep having meetings over this till we figure something out. I guess when would be the 2 week start of school, Labor Day? I mean, that's coming up, and then I guess
we voted 2 weeks ago to go 2 weeks so that the students and the teachers would have time to learn the hybrid method. And I think maybe that was my suggestion because I just felt like we needed to learn how to do hybrid. And I felt like the best thing was to do it right now, at the beginning of the school year, instead of going face to face and then thrown into hybrid. So I believe we voted, to go 2 weeks, which would be the end of next week. So, following that meeting, that vote, we were, going to the end of next week, unless we change something.
But then I'm kind of guessing we have to wait till 2 weeks and then the test results, you know, if we see it. We won't know, we can't just send them back after the 2 weeks if there's a spike in numbers, because you won't know if there's a spike in numbers until whatever they say the test results come back.
To me, that's what's so frustrating. I mean, we don't even know right this minute.
Right.
What the numbers are, and I feel like we should, if we're making the decision for all these parents, is open school or not open school, face to face. I totally agree with you that, K1 or K-5 students, that has been my biggest fear since we, went into this. First grade for 30 years, and a kid cannot learn to read at home by themselves. When I listen to a parent, I almost offered it, okay, I'll teach your kid. They can't learn to read at home by themselves, and they are really, farther and farther behind. So I agree with having to do something for those kids. And
did everyone look at Adam's email from the nurses report?
Yes.
That was sent out?
yeah, it was kind of, I mean, it was factual, but I don't quite understand. Would you want to share that, Adam?
Yeah, and actually, we have the experts here tonight, if you guys want to share the data that you sent me earlier today that I shared with the board.
I just broke it down for you from week 1 to week 2. So overall, on week 1, we had 10 students, different students out sick. And then this week, we've had a total of 29 out so far. And that's just COVID-related symptoms. So it could vary across that. We've had 2 staff out sick week 1, and then we've had 3 out so far this week. We've had 3 students in actual quarantine in week 1, and then 2 that parents kept out because their parents or siblings were waiting for COVID test results. So they're not technically in quarantine because they're awaiting results, but their family went ahead and kept them home. But this week, we actually have 4 students in quarantine and then 3 that stayed home awaiting results. And then week one, we had 3 students out for testing and 1 staff member. And then this week, we had 3 students out for testing and we have 2 staff members. So those are our differences from last week to this week.
So, Holly, on those numbers, when you send somebody home, you said for COVID-related symptoms, are we requiring them to test or have a negative test before they're allowed back to school? Or I mean, do we like Major League Baseball or?
No, so after meeting with the health department, if you go home with 2 or more symptoms, you have to stay home for 24 hours symptom-free, or if you have a fever, you have to be home 24 hours symptom-free.
Thanks.
Yeah.
Are these numbers abnormally high compared to previous years?
You know, I don't normally track the specific numbers at the beginning of the year. It's pretty chaotic at the beginning of the year, but I can tell you overall, usually the first 2 weeks of school, we do not have a lot out sick. I mean, the kids are just back in the district and there's not a lot of sickness at the beginning of the year. Like I said, I don't track the number that are actually out, but it's especially, you know, having 29 of them out, that seems pretty high to me.
Are the 29, I mean, parents called and said they're sick, or they just didn't
It's a combination.
answer roll call? Or
Combination. And those are ones with COVID-related symptoms. Either parents have called in and given us those symptoms, or we've called, or we've sent them home. Any of that combination.
Did you have a question?
I'll go ahead.
Larry turned me off, so hold on a second. So this is just more a curiosity question than anything. So I know we're doing temperature checks as we go to the door. How successful have you seen that? I mean, are we sending, has anybody got caught by that yet?
We've sent a couple home with temperatures on that. I don't know
When you say successful, I don't know if
Sure.
that's something we've sent home that is, they've been sick from that.
Yeah, like I said, it's just more of a curiosity
Yeah.
question than anything. I mean, we have these measures in place, it's just,
Right.
we just don't want to be doing things, just to be doing things.
Right.
I do know the first day that it was really, really cold, like, teachers had said that kids tested with the fever, but the car was hot, they had the heater on, and so they waited a little bit.
Yeah, so we have them like shut the heater off and we recheck a couple times to
Yeah.
make sure and, or use a different thermometer after we recheck, and then if they still have it like 3 times, then we'll go ahead and send it home.
Were any of these students, were these all that were sent? The ones, were they already in school and then sent home, or at least caught when they were being dropped off?
It's a combination. So some parents have called in and others we've sent home during the day. Both.
So what's our plan now? To give a timeline, we want to just say we're going forward in a week or?
I got a one question, kind of on Jason's, what if we do the reopening, how are we going to handle the middle school? If we're concerned about social distancing now, what's our plan for social distancing on the middle school?
Because of class size or because?
Yeah, because of class size. I mean, if we say we go now, what difference if we say we go now than if we wait another week? Because we're still gonna be in the same boat at the middle school.
Are you talking not extracurricular,
The social distancing in the
right, but the classes that are really large in the middle school are they're not the core classes, they're
Electives?
electives, thank you. Is that the classes you're talking about, Chris?
Yeah, I think he's just talking in general.
In general, it
Oh,
doesn't
in
have to be a specific class. But if the concern was at the middle school that we couldn't do social distancing, and my question is if we can't do social distancing now, how do we do it in a week from now? I don't, I'm.
Well, then we'll never open, I mean, they're never gonna open.
Right, that's exactly what I'm saying, we're never gonna open if by looking at it.
But I mean, I'm gonna piggyback off what he's saying is, you know, we say we're gonna open Monday against health guidelines. Laura says next week, okay, on the 25th, you can open it full time. We still have teachers saying we can't social distance, we're not ready. And we've actually heard teachers say they're not ready, we need to keep hybrid. I mean, whether or not we open full time or not, we still have a problem with the staff saying they're not ready. They're not comfortable.
I don't understand why they're not ready myself, but I'm gonna get shot my teacher friends, but.
I think they're ready to teach, it's not that.
It's the social distancing.
It's all of the physicality.
But I think we know, if we go face to face, if we open up, we're not gonna social distance. I mean, that's the whole idea of.
And that's what I'm saying, it doesn't matter, because at the middle school, we won't get to that social distancing.
And what's the difference if we say it or if Laura says it? I mean, people are still gonna be uncomfortable with the social distancing aspect. Is that you?
No.
Oh, okay.
I mean, we're gonna wear a mask, and I did. Wearing a mask is the number one.
I'm saying, if we open, how are we going to do the social distancing at the school?
We're not.
It doesn't work, exactly, we will not be able to.
Right.
That's the whole deal, so.
Not anywhere.
So not just the middle school. But that's why you're wearing a mask.
Exactly, that's why we wear the mask, so the 6 foot.
Doesn't matter.
Doesn't really matter.
Yeah.
So that's how we're gonna do our social distancing and get these schools open. That's where I'm leading to this. I know you don't agree with me, but I'm saying that the mask is the major thing. Not so much 6 feet, it could be 3 feet, I'm not sure who said the 3 feet. Right, yeah, and you're a health professional, right?
Yeah.
Okay, so I got a health professional telling me 3 feet. I don't have to, if I take her position as a professional, it's 3 feet, not 6 feet. Now we're getting closer. But the key is the mask.
I heard yesterday, I watched every news channel to be up with all my family, so I'm on everybody's side. And I know there's signs, that wearing a mask is going to be even more beneficial than a vaccine right now, because it spreads through the air. And so, but you can hear all kinds of things. I think we just need to decide. I think it was Jason, what is, if we go away from the health department, what are our own guidelines, or what are we going to go by? And
I mean, just because we say we're gonna go against the guidelines that she's put out this week, and we're gonna go ahead and reopen, doesn't mean we have to completely ignore anything that they say.
Right.
I mean, like she said, the other surrounding schools are still calling her and asking her questions. They're just making they're just saying, okay, there's live people in the community, we're gonna keep them open. I mean, I don't think there's anyone saying we don't ever want to listen to the health department again. I just think, I think we're just saying, we're gonna go ahead and go against what you're saying this week, and we're gonna go ahead and open.
I think the confusion,
County commissioner, they were against the health recommendations, but doesn't mean that they're not in communication with them.
Right.
So that's what we need to do.
I think the confusion is, I still don't know how many cases are in Wellington. That's the biggest thing. If we decide we're gonna not go by the recommendations, what are we gonna use if we don't know how many cases are in Wellington? So that's the hardest part about this equation. We have to have that number. I mean, we cannot make this decision without that number.
And Chris, I agree with what you're saying there, but I just do real quick, suggesting social distancing, and it pulls up the CDC site. One particular site, I'm sure there's a ton of them over there, and it says 6 foot, or about 2 arms.
Right,
So
I'm going by what she said on her.
I understand that.
There's so many things out there. It's
That's just
yesterday
the pediatric recommendation. They recommend 6 feet for adults because we're more likely to have the symptoms of coughing, sneezing, so we're gonna have stuff fly in further than as a kid who's asymptomatic, they're not gonna be, most of them don't present with those symptoms. They're typically the.
And yesterday, the head of the CDC was in front of Congress saying the mask is more important than the vaccine.
And don't get me
then he
wrong.
had to back that down.
Sure.
And put it on his Twitter account that he misspoke. So it's hard for us as a board to figure out what we need to do when we're constantly getting information and every hour it's changing.
Yep, I agree. And don't get me wrong, I want to go back face to face, I want to go full-blown school, don't get me wrong, but I think we have to do it safely.
I just think
And
it's
you're
time to
absolutely
get these
right.
kids in school.
I guarantee you tomorrow morning when we wake up, they're probably going to be telling us something different. That's just the nature of this thing. I mean, they told us not to wear these things.
Right.
For a while, and then they came back and said, you need to
Came
wear
back
it.
and said, hey,
And then they said these masks would protect me. That's the reason I'm wearing this mask, is to protect me. And now they're saying that the mask is better than a vaccine.
Right.
So it changes daily, and I'm not watching it daily. I'm not a healthcare professional. I'm not watching it daily. I got plenty of other things to do. But we pay people through taxes. We pay Laura to make these decisions, and I just don't know how we can, with 4 days worth of it, I don't know how we can say that we've given it a fair shot. It's just my opinion.
Jason's got the.
Sorry.
Thanks, I know I did it to you. Jason's looking at the mission statement in their reopening plan, and clearly says, the health department guidelines that we would follow. And the one lady did point out that what I think we handed out, that's what we handed out.
We passed this reopening plan unanimously, and the mission on the second page, sorry, I'll get to mine. The mission statement on the second page, for what it's worth, says to provide educational opportunities for USD353 students while following local health guidelines to promote the safety, well-being of our students, staff, and community. We voted on that and passed it. So I struggled a week later saying, nah, we're going to change our mind. Again, the
this money.
What are the numbers regarding other things in the community? Suicide, drugs, depression, everything else. We're talking about COVID and only COVID and the symptoms of COVID and the safety of children, but we're not looking at those other things. So the health department should have this information as well. They should know these percentages. Which one outweighs the other is something that also needs to be considered. Apologies for interrupting.
I'm afraid if we, we're doing, okay, 2 weeks, and then that period will be over. Labor Day will have happened, school will have started, and kids have been in school 2 weeks, and so we'll have those numbers, maybe not. Then it's gonna be flu season. Then, I mean, it's always something. And when.
Also, I'm sorry, we all keep listening in, we have 3 minutes. But another question of mine is if we do continue to follow the health department guidelines, and that was less than 5% was green, good to go full time.
Yeah.
So those numbers change constantly. So we're gonna say green, you're good to go, and then 4 days later, hey, we're at 6%, shut it down, we're going back hybrid, and then, oh, we're at 4%, go back, and now it's 8, close down. I mean.
Well, we were planning on going week to week, and so that's
So
what
when we, yeah, it's so crazy. I mean, we need something stable.
I think we need to decide what we're going to do. We got the emails from all the people, and I was surprised how many actually said to open up. I didn't do the percentage of teachers and parents, so it weighed heavier on the opening up side. I have heard from teachers though that one reason they're concerned is they don't have cleaning supplies in their classroom.
I thought we got agreed.
They don't have wipes, they don't have, the high school anyway. In the middle school, they buy their own wipes, they buy their own. At church, we have a spray bottle at the end of every aisle, we can clean. Well, I don't know,
I do remember reading that email from a teacher saying about cleaning supplies, and I was like, there's no way. Like, how many cases of cancer?
Yeah, we have a ton of everything.
Thousands.
Can I say something to the board?
Sure.
I'm sitting here thinking, as you all are, as I'm listening to people talking. And the frustrating thing about this debate is nobody's wrong. I mean, everybody, there's no clear answers here for, what is perfect for this. And that's what makes it most frustrating for everybody, the plan we put together is absolutely not convenient and very fluid, and it is tough. And if we need to make adjustments to that in the future, then I think we can do that. I think we can find ways to adjust our plan. Our plan should be fluid, and it should adjust to things as they come up, because everything is not black and white and stays perfect throughout the entire thing. I do think that you have a lot of parents who are struggling with work, and they're struggling with their life, their daily life, as we all are. We've all had kids. We've all been a part of this, and whether our kids are young now or whether they were young, we can all put ourselves in the shoes of those parents. And if there's some things that we can do to make things better K through 5, then I think those are discussions that we can have to make things, better for some of our parents who are struggling with things at home. That was brought up today, and I think that's a great idea. We have the rec center who has jumped out and tried to help with that, and maybe we have other community people that would, help with that as well. We also have a big population of people that are counting on the board to follow through with a plan until they had a chance to change at the 9-week period. In your survey, you had 111 students that, if we went against medical advice, wanted to jump ship and go remote. And that is going to be very difficult on the district to plan for. That's the piece that I was talking about the other night. When we first put this plan together, we put together a remote plan for students for 9 weeks. And that plan has been executed, and we were planning on adjusting that at the 9 weeks whenever people were allowed to make their choices to go back and forth. And I think that is something that would be very fair to your parents to stick to that. However, if in the future we have a different way of checking with medical advice, which I think is a concern this evening, then that is something that we could adjust in the plan. I think we're hearing a lot of things that we can talk about and move forward with this evening. And I'm telling you, the one thing that I will struggle with as an educator, I have no doubt that if Dr. Yarmer or Laura have a question about education, then they will come to us and they will ask that question. There is nobody on the face of the planet that comes to me for medical advice. That is not what I'm trained in. So the original thought behind this was, let's base this off of our experts. And some of that is unfortunately not convenient. So maybe we can make it more convenient. Maybe we can make the advice we're seeking from medical professionals, something that everybody feels better about. There's lots of things to improve on, I believe. So I think that this evening you have a group of people that are going to be frustrated no matter what decision is made. Not that a decision has to be made tonight, but if a decision was made, I think you'd have people frustrated on both sides. You'd have people that feel like you went against their plan. You'd have people that feel like you're not listening on the other side. And just like Tom said with our survey data, much like our country is these days, this is a very split topic in our community. And so somebody's not going to be happy no matter what. We definitely are in the position, and we're planning to already adjust to remote and in person for those people who wanted to jump back and forth at the 9 weeks. I do think that would be the most appropriate time for the board to make a major change. That does not mean that we can't go full in person prior to that if our medical professionals say, oh my gosh, yes, we're doing good, and jump in, which is what we all hope for. So, yes, Larry.
I think one of my nightmares scenario would be if we were flipping back and forth, bouncing around. I don't know how you can teach a kid anything under those circumstances. So I guess I'm thinking it'd be great if we could just get to a point, make the change, and then not change again. But, it may not work out that way, but I sure hope we could try. I sure don't want to go week to week. The teachers can't teach that way.
Adam, I also want to thank you guys. Getting that survey out and getting the data back to us that quick. I know we put a lot of strain on you and your staff once again, last minute.
Sure.
I think the other thing, I'm not going to ask for another poll, but I think there was a big misconception that there was a 9-week commitment to remote, hybrid, or full. And so I think, I know 111 students said, or parents said they would go remote if we went against the health department's advice. I'd be curious, with the misconception of the 9-week commitment, if the health department says it's full, we're ready, you guys are good to go back full, how many at that point would switch to remote? Because I'm sure with the misconception of the 9 weeks that number would probably go down. I think there's going to still be students switching to remote at that.
Sure. Yeah. My personal opinion on that, just from my experience, is I do think that was absolutely a early misconception in the community, especially before we had them actually pick in person or remote as the two options. I think there was, because we were talking about potentially being in remote as a district, in hybrid as a district or in full-time as a district. We were leading up to everybody getting ready for that, to decide when they came up to fill out that piece of paper. And so I feel like the misconception was definitely there early on. I feel like that misconception has faded over time as people have gotten information. So I don't feel like it would be a huge jump, but that is absolutely just my personal opinion.
I am disappointed that we didn't have any answers tonight on the numbers. I mean, we knew what this meeting was for, and if we meet with the health department weekly and they give you the information, I would have thought that we would have that information now, so that's disappointing. And the second thing is, I just always thought, whenever you make a decision in your classroom or even your own children you're raising, do what's best for kids. And I think being in school full time is what's best for kids. I'm just afraid if we're going to go, like I just said a few seconds ago, from Labor Day, then there's never going to be a time to try it. And I hate to say we're just a little bitty going in Kansas, we're a little bitty Southern County, but there's schools all over the country opening up. Just up the road, Derby, Kansas is, I can't imagine what their high school looks like in between classes, but it has to be crowded. They've been open for, the same as we have. There's one football game tomorrow night in Endale, and anybody they can fill the stands, and most of the places I know are just giving 2 or 3 tickets. So it's not that you don't trust the medical professionals or you want to go against them. I just think there has to come a point where we go on with our lives, and that's my stand. So if we want to wait for, the 9 weeks and make that decision, then it's going to be flu season, so, I'll do it.
I still agree that we should probably, let's give it a little bit more time, but we have to set an expiration date on at least the K-5 kids at a bare minimum. We have to, if the health department's not going to give us the green light, we have to figure something out to tweak that. We've already gave, I think Adam mentioned, we have voted 3 times on this plan, and he's got the green light. If the health department says go for it, we're going. We're going to go open the school up next week if they say it's okay. But we can't, I agree with you 100%. We can't just keep putting it off and putting it off, because it'll never happen. And then we'll be missing graduation again next year because we never open the school back up. So I don't know if we want to try this. Does anybody else have an idea on expiration date for K-5?
Will be the 22nd, which will be Tuesday. So, Adam, are you meeting for Monday, the 21st?
We've moved to meeting each Monday, and then if the board, we'll talk together about, what we want to get for criteria for getting, medical opinions on our decisions.
So if Adam meets with her the 21st, then maybe we need to do a meeting on the 22nd and discuss the K-5, or she could be giving us the green light.
Right, I don't know if we want to set a meeting time as more of an expiration date for the K-5 is. I think if Adam's already got the green light, if she gives him the green light, he's going to pull the trigger. I'm assuming we'll have to wait till the following Monday. You're not going to meet with the health department on Monday and start school on Wednesday or Thursday. So
correct.
So Tom, just a little clarification. I agree. We got to do something. We got to set a stake in the ground someplace out there, especially on K-5. But what's the criteria on that? I mean, are we just totally, so if there's the uptick, if Laura gives Adam news Monday, are we still going to have that same expiration date, no matter what the numbers are? We're still doing whatever we decide.
Well, unless the staff can work on it at some kind of a tweak, like Adam said, they're fluid in that. We probably not too late to pull the McKinley building back off the market. We have that real estate to use if we have to. I don't know.
I don't know that it would make the inspection. So, kind of to piggyback on what Tom was saying, I mean, this plan, I think the staff did a great job on it. I appreciate the work that was put into it. But I think Adam even mentioned at one of our meetings that it's ever changing, and it has to be ever changing. Because this pandemic, virus, whatever you want to call it, is ever changing. I mean, just like I said, we're getting different information every day. So this plan has to be able to be a little bit fluid, just like the part that I read. And I wasn't reading that to put us on the spot. I was reading that as, this is what we agreed to. But maybe that doesn't need to be in there. Maybe we need to look at that plan and see if there's something we can take out of it or needs to be modified, or maybe this whatever we're talking on K5, whatever we come up with there, maybe that needs to be in the plan. It needs to be constantly evaluated, because I think this thing is moving on us regardless.
Okay. With that, we just stick with our, I don't know what to say.
John, what are you thinking on your drop dead date?
I don't have a drop dead date. I was asking more of a discussion.
I guess what on your date?
And
what are you thinking?
There's two sides to that. If we say, okay, we're gonna give this 2 more weeks, and if we still can't go back to school, we'll have another meeting and decide that. But are we really the ones to decide? And once again, we'll put Adam and his staff through the grinder to bang out this K5 plan, and then the health department will say, okay, you go back to school. So
yeah, that's what I'm thinking.
that's what I'm afraid of, is we've drugged those guys pretty hard ever since the beginning of school, is doing stuff at the last minute for us. And I don't know if it's a board decision to work on the K5, if the staff can come up with ideas on the K5 tweaking.
I think it's much more, much more on the staff to come up with ideas for that and put that together than the board. And like I said, we should be listening to our community, and that is what we've been doing all week. That's why we're here again tonight. And we have a very split community on this, and we need to try to make that work. And that means that we make adjustments so that our community feels more supported all the way across, not just 50-50, but we have a large number of our community that feels comfortable with how their school system is running. And so, although it's split right now as far as this decision, 50-50 is not a good thing when it comes to a community. Community needs to be on board with each other. And so that is not where we're at right now. And so if adjustments need to be made, then they need to be made. And we need to listen to both sides in order to make that happen. And with this particular topic, there is no two sides. It's all over the place, really. So we need to do that. I do think that unfortunately that's going to take some time. My hope within any day is that I talk to medical professionals and hear, let's go back to school full time. I'm ready to hear that as soon as it'll come. And whenever, and like I said, we can change that criteria if we need to. But I do think that for your other 50% of people who are nervous about things, don't forget that you have 15 to 20% of our students that went remote before the year even began, that are at home right now, that are part of this population as well. So we need to, have some time to put that together, to be fair to our parents that signed up for 9 weeks. And I do feel that at that time, if the board is going to make some sort of change, then that would be a more appropriate time to be fair to everybody that they put a plan into so far. And because in the current plan, it already has that as an adjustment period. So I think that would be fair to everybody, and hoping that we go back full even before we even get there. And at that point, if we make adjustments to the plan and have the board reapprove it, as they have in the past, then we can move forward with the adjustments. Yes, sir.
I just want to say that all these emails were well written. I mean, there's a ton of information, in those emails, and it was really helpful to us. I mean, like you say, we're not in their shoes, and it helps to hear it.
want to say something real fast. I'm sorry, I don't want to interrupt. You want to say, you just said 50-50, and earlier you said, parents that are surveyed, 65% of the parents, you said 68 first, then you said 65% wants to go back full time. If you take into the teacher's consideration, it becomes 50-50. I don't believe all the teachers in this community have children at home. So you say 50-50 split, I don't understand where you're getting 50-50 split. It's not a community 50-50 split. It should become the parents that are in charge of these children every day, it should become their decision. And 65% is a majority, which to me says, let these kids go back to school.
Sure.
So I'm sorry.
No, you're fine.
Would you like me? I'd be happy to answer that for you. If you
Yeah, please.
Okay. So when I'm thinking about it, I'm thinking about it as all human beings in a school building. So I have employees, I have parents that come in, I have students. So I'm thinking about the entire population. So when Tom said earlier about putting the two together equal to 50%, that's what I was referring to as all the people that are coming to school every day. So I have to take my staff's, comfort level with this in case as well as parents and students. Does that make sense?
I'd like to clarify that.
You said community, and I take community as in.
Okay. Maybe I should have said school community.
Parents that pay and send their kids to school is the community. Teachers are also, they're paid,
Right.
Yeah, I would like to say that when I read the results of this survey, there were 65% of the parents that said they go against the health department, and I'm one of them. I'm ready to open up. Now, when I flipped the page and seen that 65% of the staff is against that, the staff doesn't work for me, but I feel like I'm not going to ask anybody to do something they're not comfortable with when I'm making decisions for them. So that's, when you add those numbers together, it is a 50-50 split. And I would actually lean more towards the staff because that's not right for them to not be in that situation, be comfortable, and me force them to do that.
Don't you believe that they are essential employees? Just like I am with the BNSF Railway, I'm an essential employee. I have to go to work. We got to go up point, it all broke out, going intermingling with people from Kansas City and Amarillo and everywhere else. Walmart employees are essential. Why aren't teachers essential? They are teaching our children. They should be essential employees. They shouldn't have to say whether you got to go to work or not. If they don't want to go to work, don't go to work, go find another job. That's my opinion. They should be essential employees. They shouldn't have to say whether they want kids coming to their school or not. They are paid by us to teach our children.
I think we just, the survey was pretty cut and dry what it meant, so.
Yeah, you asked me if I wanted to.
Yeah, I know.
I said yes, 65% of people said yes. That's the majority. Teachers should not have been pulled in this. They should be essential employees that have to show up to work every day to teach our kids. And if they don't want to do it, that's fine. I understand. Go find someone else to work.
Well, so we're just going to wait till.
Laura, if you're meeting with Adam on the 21st, can you just have the Wellington numbers? Is that possible?
I will try and get those numbers as quick as I can, so yes.
So that way we can.
I would like to caution people not to, we're a mobile society. Again, I would like to see school open up. I think it's best for everyone. I think it needs to be done incrementally until we know how this is going. My big fear is you open up full and then everything, spikes and then you have to shut down. And that's going to be your decision on a lot of that, not my decision on how and when you close your school. So I will get your numbers back. I just want to caution you on trying to work on those numbers.
Thank you.
You're welcome.
So I got one question there, Laura. So,
okay.
And I should have looked this up ahead of time. Yes, actually, I looked up part of it, but I'm not sure I'm understanding exactly what I'm seeing. So, don't you have the authority to shut us down? Under KSA 65-11-9A, I believe you do have that.
I probably have the authority. It just would take some legal steps and probably involve lawyers and,
Correct.
and it's
But
not
you've
like
chosen
I,
not to do that. You've
Yeah.
chosen to make a recommendation at this time. But if things
Right.
would spike,
if things, what I would deem as a public health emergency, that's when I'd probably step in and do that.
and you're granted that authority via Kansas state statute,
Right.
right there. Okay.
But that's not how, I mean, I want people to know that there would be steps to go, the legal steps, you know, lawyers and judges
Right.
probably
And
would be,
none of us want to go down that path.
no, we don't. And it would be the last option I would do.
Sure, sure.
That's not, it would not be the first option.
Sure.
It would be the very, very last option.
Okay, thank you.
Okay, I said I was done talking, but I got one last question, and I'm done. Did we, with this 5% number, is the wording of that 5% of the county or 5% Wellington?
I assume it's 5% of the county is how I take that.
Okay,
See, that's where I'm frustrated, because I asked Adam on Monday, I believe, how are we basing our decision, how's the health department basing their decision for the system? He said it was Wellington. He only wanted Wellington numbers, so I'm frustrated right now because we're asking more for the Wellington numbers, and she can't give us what she gave him on Monday. Because we all sat at the meeting Monday night thinking, we were told yellow, we were still in hybrid based on the numbers, but Laura's saying she doesn't have those numbers. I'm very frustrated by that, because we have parents right now depending on us to make a decision for their children, and we're sitting here going, well, we're depending on the health department, and the health department's not giving us numbers. I'm very frustrated.
and the reason I was asking, I think, if I was gonna vote against the health department, and I looked at 5 active cases, or whatever the 20 active cases, and I found out that only one of them was in Wellington, I would have zero problem going against the health department recommendation, and that's where I think
that's where a lot of the parents are,
Yes.
because if they're all in the northern part of the county in Mulvane,
yes.
what are we doing in Wellington? And that's why I was talking to Adam. We need Wellington numbers. We need to base it. He said, I think he's under the impression that we were only Wellington. So, and she's saying it's
And I think
The gating criteria from KSDE says county, the county percentage rate less than 5%. So if that's what you're following, it would be the entire county, not just the city of Wellington.
But like when I talked to Adam, we were all under the impression that we were using just the cases in Wellington, because we need to worry about our district and what's happening here.
That could be our miscommunication.
Yes, that's my impression from the conversations, and what I've been passing on to the board have been based off of Wellington only numbers in our conversation with Laura. So if there's a miscommunication tonight, then that is not any intent. So I understand the frustration.
Well, I think Monday we'll have just Wellington. The 21st, okay.
But if we're gonna follow the gating criteria, we have to, the health departments, we have to do 5% for the county. So which is Wellington numbers, wouldn't be going away from the health department, right?
Yes. And like I said, I would use those numbers if I was gonna vote against the health department's recommendation.
If you're doing 5% of the county, how are all the other school districts in the county open?
That was exactly my question
Yeah,
earlier.
I think Wichita is going with under 10%. When it gets to 10%, they'll look at it.
I think she was asking like the I'd asked that question earlier, and I'm still a little bit confused, but Belle Plaine, Oxford, all the schools that are going full-time, how are they using the same 5% gating criteria? And they're open, but we're not.
I don't think they are. I mean, I don't think they must be following it, because I know.
Unless,
I watched Kaysville's board meeting and they were just using it as guidelines. And they voted outside of the guidelines.
so Belle Plaine, all the other districts are going against the health department recommendations.
They are making their own recommendations, and I think the way that gating criteria is going is the data is going to be on the websites, and you will eventually be able to go up there. In fact, you can do it now and look for yourself and make your own decisions. school districts have the authority to make those decisions at the moment. I'm providing information because this is a new thing that's coming in, and I'm working with Adam to do that. But the state is only using county data on those websites. And they're using I have to use some of that because we do not know all of the tests that are done in Sumner County until it comes through the state.
Okay.
And that's what's frustrating. Information's always delayed, and that's frustrating. So, I think I need some closure here. I know I'm supposed to be running the whole meeting, but, what do you guys want to do? Just wait till 9 weeks? Do you want to just keep going until the health department says green light, or?
We do, okay, so we do have the authority, this 9-week commitment, we can do whatever we want to it at the end of the 9 weeks. So if it looks like it's going to be 12 weeks, obviously at the 9-week period, the board can reevaluate the gating criteria. It's my understanding.
So we'll just.
I don't want to see it go 9 weeks personally.
I
do want to stand by the commitment that we voted on to the parents. With the gating, working with the health department. But also at some point, we have to call it quits in my book.
That's kind of what I was thinking. If we did put some stakes in the ground, say at the end of September, the end of October. But at some point, we have got to
open up.
Yes, we do. But we need to follow their guidelines, but
yeah,
hopefully it'll work out.
I do have a question on the sports attendance. Was the sports attendance actually in the reopening plan? Is that part of the 9-week commitment? Or was that kind of a separate issue?
I think that came out later than big high school.
So we can change that without voiding a 9-year or 9-week contract that we made.
Who made up the 25% rule?
That was the health department.
It was a league recommendation.
Oh, it was, okay, I thought it was the health department, I'm sorry. But we are allowed to overrule that too.
Well, that's what it sounds like most places are doing, the 25% deal. And that's, Luke Smith told me, that's how they came around to 2 tickets per athlete that more or less got you to 25%.
I think you're going into a little bit dangerous area. If you can't open school, why would you want to increase the attendance at school?
I agree.
Yeah, I agree. At least we didn't put that in writing somewhere. My parents signed it. That was just where I was going with that.
Well, let's just pick a day. Pick a date. The end of September, the end of October. I think we have to. We've all said that. I think we're all in agreement.
So,
at the end of, like, pick a day and what?
Yeah, that was my question.
Yes, the health department?
Yeah, what, pick a day to do what, yeah.
And then decide what we're gonna do, open up first.
I think next week we need to get together and figure out what we're gonna do with the K-5.
Well, we may not have to if we open up and everything goes good.
Well, what if it doesn't? And then our kids, Dr. John is even saying in a couple of weeks, we've got to do something with these kids in that elementary.
Yeah, well, I gather that I do think, I've got some great ideas, but I don't think it's my job to come up with.
No, but I mean, I don't know if we need to have a meeting, but I don't want to just walk out of here with no plan for the elementary.
Yeah.
I don't need a meeting to do that, but I just want to make sure something's happening.
Well, you know what, I know what's gonna be said, because I think, some of the teachers that voted that they weren't ready, or that they wouldn't be comfortable, were upset that we were already gonna drop the hybrid, because they spent all this time working on hybrid.
I think that's a misconception.
I do too. I mean, I want to hear from the teachers that, I go home to 90-year-old grandma, I have diabetes, I want reasons like that, why they're not comfortable. Not that they spent, all summer getting hybrid ready. The whole reason we got hybrid ready was hopefully to do away with it. So, I mean, I know it was a lot of work.
Yeah, it was a lot of work, but I don't think because they're saying that it's gonna be more work, to go full.
No, they're not,
They're used
yeah.
to going full.
Right.
It just feels, I feel like they're saying.
I think a lot of them do too, but I do think there's a percent that work hard on the hybrid and don't want
But I think Adam was saying that staff could probably have some good ideas on K through 5. Right?
Oh, yeah, no, I think that's.
Yeah, for K-5.
I would rather have them work on it.
Yeah, I do.
have no clue.
And I don't either, I just want a plan, I
Right,
just want.
but I think Adam said we were gonna be.
Sure, oh, yeah, I think it's a, yeah, I think it's a good suggestion.
Okay, so, I'm still at a loss. I personally want a
Well,
deadline.
2 weeks is the 22nd, and that's from the opening of school. We probably need to wait till then, so we can see what the numbers are doing, and then revisit it.
Yeah, I'm okay with that. I just think it's always gonna be a 50-50 split, I mean.
Well, to me, we're probably always gonna be into the not yet phase, no matter what happens.
Right.
So we're always gonna be in the not yet phase, but if we give it to 2 weeks because of Labor Day, and then the 2 weeks of school, then we can see the numbers and see what's trending.
I think that's fair. That's what we said, and
But I think we're always will be in the not yet phase, just basically like you were saying, flu season's coming, this is coming, this is doing, this is doing.
So Chris, I got a question. Would you be, 2 weeks would be the 22nd?
Yes.
Based on what we've heard as far as some potential complications on testing, getting results back, stuff like that. Would you, I mean, what are you thinking, maybe had it by a day or two, so maybe a week from today, we meet back?
Yeah, I'm just saying 2 weeks was the 22nd, so we
Sure.
need that.
That would get us past that mark.
Right.
So we should have some good data, hopefully have some good data.
Right.
That would give Laura a chance to maybe get us some local data.
Or we're having the planning session on the 28th.
There you go.
Yeah.
Let's do it there.
I would like to quantify that is, let's not just say on the 22nd, if we're green and going full, we don't need to have that meeting, so I don't agree.
And hopefully
Well,
that's the case.
yeah, but if not, if we're still in the not yet phase.
So we'll just revisit the whole thing.
28th, when we're having our planning session to take up.
Okay, that's fair. I think that gives backup time to catch up and.
We actually want to do that session.
Yeah.
So just.
Well, we could have a special meeting.
Right before.
Yeah. I'm just saying, we're all gonna be there on the 28th, so.
Okay.
I appreciate
We should have
that.
a special, if we need it.
Okay. Well, I'm just gonna say again, I appreciate everybody answering the surveys and speaking and the staff. This is one of the best, I've always attended, school board meetings, I've always come to the things they've had, here to ways to cut money, and, I hope you guys in the audience feel comfortable sharing, and we haven't always had the interaction during the meeting, it was just kind of, we used to 25 years ago, you know, we could open up and share some of the things like you guys have done tonight, and, I just think that's a good way to be open and, nobody attacked anybody. I think we were all responsible adults and shared our thoughts. I know it's a passionate subject and there's never going to be a good answer. And I don't want the people out there to think, well, here they are again, they can't decide what to do, they can't decide what to do, because I think if I'm reading this all right, we all want to open up, and we're not going to, we are going to come to a point where we will open up. So I just want all that to be understood, and unless anybody has anything else to share. Dave, you have anything?
I'm sorry, go ahead. I didn't know if you needed the executive session you added earlier.
Oh.
Okay.
I don't think so, especially with no action.
Okay, I just want to make sure. Yep.
So we already have
I appreciate Martin being here in case we need him.
Sure. Yep.
we already have a planning session on the 28th for, class size and looking at that. So we'll go ahead on the 28th and make some type of decision on.
If we need to.
If we need to, we'll probably all be at school by then and 4 football games and 28 volleyball games, and we'll be good to go. So noticed it, I will adjourn the meeting. Without a gavel, meeting adjourned. That's it.